So I wanted to talk a bit about what I think is a really important study that was just published in the journal Health Affairs. The author was David Arterburn and his colleagues from Group Health in Seattle, Washington, and it reports on an experiment of distributing decision aids to patients who were facing surgery either for knee replacement or hip replacement. Now first, I think I should make sure everybody knows what a decision aid is. And while it comes in various forms, the ones they used were audiovisual programs on a DVD that describe for patients their options, what they could do given their clinical problem, and outlines the pros and cons of each of those options. So they're really informed when they make a decision. And at Group Health, they distributed these decision aids to a sample of patients over a defined period of time, and looked at how that affected the kinds of decisions that seemed to be made. And the results were actually quite clear. When they compared the results of the group that were routinely offered decision aids with the group that was not routinely offered decision aids, they found that the informed group, the group that got the decision aids, opted for less surgery, and that the total costs of their care over the period that they studied were less. So I'd like to say one final thing about why I think this is an important study. I think we're all concerned about getting the most value for our medical care, and most people are concerned that maybe we're spending more than we should on medical care. But the idea of some third party or someone outside telling doctors and patients what they can do and what they can't do is not very attractive. The neat thing about this study is it was informed patients and their doctors who were making decisions about whether or not surgery should happen. And it demonstrates that when patients are really informed and they talk with their physicians, that they make conservative decisions, more conservative decisions than they would when they're not informed. And that seems like a kind of model for improving the cost of effectiveness of our medical care that we could all get behind and think is a pretty good idea.